So I'm really excited today for our first webinar in our Big Ten Augmented Intelligence Bowl seminar series. Before we get started with that today, I just wanted to do a brief recap of our semifinals. So for those of you who don't know what the Big Ten Augmented Intelligence Bowl is, you will have, the quick 5-minute guide and also a quick introduction to the Institute for Augmented Intelligence in Medicine. So really quick, we want to thank our sponsors. We had amazing sponsorship from HCSC, otherwise known as Blue Cross Blue Shield of Illinois, Texas, New Mexico, Oklahoma, Montana, and also Vizient, Expert AI, Anthem, I.AIM AI, and Nokia Bell Labs. And so without them, obviously this bowl would not happen. Also, in the prior bowl, we had an amazing panel of judges for the semifinals, which they selected the 5 teams that are moving on to our finals. So we want to thank them as well. And then we started out on April 30th with 8 contestants in the Big Ten AI Bowl. And during that pitch competition, we narrowed it down to the semifinalists. So we want to congratulate University of Illinois at Champaign-Urbana, and then Pennsylvania State University, Indiana University, University of Wisconsin-Madison, and Northwestern University as well for making it to the finals. They will be competing in October for 22nd for the finals event to determine the winner of the Big Ten Augmented Intelligence Bowl. So this series is intended to be an education series for those teams, as well as, with some selected ones open up to the public, so that the actual innovations, the Institute for Augmented Intelligence in Medicine was really created because we understood that machine learning and artificial intelligence and high throughput computation are great tools and technologies, but underneath the covers of that, you need the human expertise in order to really truly take advantage of the technology and make sure that they're going in the right direction. So we were created in 2020 in order to make sure that we have that collaborative spirit between human expertise and our machine learning and artificial intelligence. So without further ado, I will introduce to you today our speaker. His name is David Grady. He is really, truly a Renaissance man. David, in addition to his current role as the Chief Security Evangelist at Verizon, he has in the past worked in risk and security at Citizens Bank. He's also got a big TED Talk about time management, which I'm sure we all need. He's been a writer. He's been a press secretary. I don't know if there's anything
I can't keep a job, clearly.
I don't know that there's anything that he doesn't do, right? So welcome, David, and I will let you take it away, and please feel free to, those of you who are on the call, feel free to ask questions, and then we'll have some time as well in the back end for you guys, for David to address your questions.
Well, thank you so much for having me. I really appreciate it. It's quite an honor. I'm going to share my screen here if I can get there. Okay. But if you're asking yourself, why is the guy from Verizon here talking to me? I can promise you I'm not here to try to sell you a wireless plan, although we do that, but that's a different conversation. Verizon, if you don't know, is one of the biggest global telecommunication companies in the world. We spend billions and billions of dollars on the infrastructure for internet networking, for voice networking. We've got one of the largest global backbones in the world. And we have spent billions of dollars building out the 5G infrastructure that we believe is going to drive what we're calling the fourth industrial revolution, or Industry 4.0. We're really excited. These are very exciting times. And in addition to providing that network connectivity and that wireless connectivity, Verizon also does quite a bit of work in professional and managed services around things like unified communications and cybersecurity. So I'm here from the cybersecurity team, And I just wanted to kind of give you the perspective that Verizon has on the healthcare industry, how it's intersecting with technology, and how we're a part of that, but not a Verizon commercial, I promise. I do want to share with you some of the research that we've done, and I want to make sure that you feel like after 45 minutes or so that you learned something here, not just about the company at all, but about the future of healthcare and technology. So, we're seeing, as you all know, I probably am preaching to the choir here, but things are changing. Things are changing fast. We've got IoT, we've got AR, VR, we've got autonomous vehicles, we've got artificial intelligence, as you all know. 5G is behind a lot of this. The innovation that we're seeing in healthcare is pretty astounding, and the promise that we think is really huge. I want to share an anecdote from late 2019. I was in Chicago, actually, for a 2.5-day session with Verizon customers in the healthcare industry. We call it a CAB, a customer advisory board. So for 2.5 days, we were in a beautiful hotel downtown, and we had people from the whole ecosystem of healthcare, from the payer community and the provider community and the technology community. And for several days, the leaders, the IT leaders, the business leaders, the C-level leaders were sharing their insights and their plans and their visions for the future. So again, this is just before COVID sort of erupted, late 2019, right around Christmas time, a little before that. And I was so privileged to be in the room listening to all of these incredible leaders from all over the country sharing their vision for robotic surgery and for augmented reality in diagnostics and AI and diagnostics and such. And it was incredible conversations. But then we did breakout sessions. And in the breakout session that I ran, it was on cybersecurity. And we went from room A, where everyone was talking about the incredible Jetsons-like future where everything is to be connected and IoT and smart. And then we had the security conversation, and everybody in that room was confessing to the very same struggles that so many industries are feeling right now in cybersecurity. The basics, the blocking, the tackling, the cyber hygiene, all the dynamics that are affecting other companies and industries. Healthcare was saying was hurting their ability to secure their environments. Not enough people, not enough skilled people, not enough people that you can retain and hire, because there's a real glut of talent out there, and too many jobs are open. The attacks that have been we're going to talk about in a few minutes on healthcare organizations from cybercrime, have been growing and growing and growing. So on one hand, you had this big community of leaders, really heavy hitters in the room, talking about the 23rd century of Star Trek-like medicine, but on the other hand, they were grinding their teeth over basics of security. And I thought that's really interesting because it sort of illustrates that friction that I think you folks here on the call can help alleviate over time with your involvement in the way that you approach your work in the next few years. So I did mention that Verizon has put a lot of time and energy into working with healthcare organizations. We have a view about what healthcare is, and particularly we look at it through that technology lens. So I just want to share with you, from our perspective, how we see the landscape here. We understand, that the regulatory reimbursement issues have been challenging, particularly with the telehealth. How do we get reimbursed for that? That's sort of come out in the wash, I guess. We know that social distancing in the last year super disruptive to your operations. My wife works at a hospital, and the protocols that she and her staff had to go through, and the patients and such, that drove so many disruptive changes to the basic day-to-day workflow, but also the technology that sort of closed that gap, right? Do you have remote workers? Do you have enough VPN, virtual private network capacity to enable people to work remotely? Do you have that security in place that you need to support that remote workforce? And then, the disruption of supply chains. The word, I was going to go to that, the HIMSS conference. I was going to go to the HIMSS conference that got canceled in 2020. And the buzzword around that one was ecosystems. Everybody uses the word ecosystems when we talk about technology and healthcare. But the ecosystem for suppliers and for vendors in healthcare was really disrupted during the last year or so due to just all the reasons why around the pandemic, but also because of cybercrime. We saw ransomware and other attacks disrupting the supply chain there. And then I probably don't need to tell you that limited resources and financial pressures, my gosh, the number of elective surgeries and elective procedures and such that had to be put on hold. just the basic care for, the COVID during the spike of all that. We see that influencing future technology decisions that are going to be made to drive down cost and to drive up efficiency. And then the one down there at the bottom, you're probably most interested in, is we see more organizations in healthcare using big data and using AI to study the population health, to squeeze more value out of that data and to improve the outcomes. So we recognize that healthcare has got big ideas and it's got really interesting use cases and applications in mind, but the struggle can be to get there, and one of the struggles can be security. So before I get into the security component of it, though, I do want to share sort of a little bit deeper dive on what Verizon's view of the future of healthcare is, particularly the future of hospitals. Okay, so I don't read slides to you, but we know that they're going to be very data driven. We know that they're going to be very connected. They're going to be connected in more intelligent ways. More smart devices will be connected in the hospitals, in the clinical setting. Everything from IoT sensors to the health monitoring for remote patients. That's going to put a lot of pressure on network teams and security teams, but also the leaders and even the clinicians who have requirements and sort of their wish list of how things would work. They've got to be part of that conversation. We're going to look at that a little bit later. We know that the future of healthcare patient experience is really about creating a digital front door. We're not going to see a decline. I mean, we're not going to see the disappearance of telehealth. In fact, Verizon recently acquired and integrated a company called Blue Jeans, which is like a Zoom-like platform that now integrates into EHR. So you can use that platform. We recognize that telehealth is going to be a really big application. And the idea of a digital front door is sort of that next generation of the old days when you would walk into a hospital setting and you would have the information desk there and sort of white glove, red carpet treatment. That you can't do that anymore, but you need to do that digitally. So it has to be omni-channel. It has to be voice. It has to be chatbots. It has to be websites. It has to be an application. It has to be an app on your smartphone. It has to be through telemedicine, and it has to be in person as well. We believe at Verizon that AI-enabled capabilities are really going to help you folks in the clinical setting do a better job at what you need to do. But personalization comes into it as well. The experience has to be personalized, and I think it's no accident in the Verizon visuals here that we use that you tend to see older people in these graphics that we use, because we recognize that there is a bit of a digital divide, but that is a significant challenge. Not just elderly people, but also, in general, do people have the technology skills? Do they have the access? Do they have the support they need and the connectivity they need to take advantage of all these things? But we also know that there's pressure on you guys in your industry to offer more enhanced services and more multimedia experience, not entertainment, but people are turning to you as a community resource for more than just hit and run care or acute care, but for deep trusted partnership with the healthcare community in the area. We also know streamlined virtual visits are so important. We know that the idea of convenience for the user and the accessibility of it is so important, and security too. Security for virtual visits has to be paramount. I think that's a lot of the hesitancy that we see in our research that we'll look at is that if I'm going to be using a portal or a video platform to do telehealth, is that information secure? And is it simple to use? And sometimes it's not as simple as we think it is. And then finally, security. Clearly, we need to have less vulnerable systems and much faster detection of data breaches. You're going to be surprised, I think, when you see some of the statistics about cybercrime in healthcare. In fact, I think, I'm trying to stay here with my my notes. I think we have a poll that I wanted to do. So can we pull up the first poll, please? Actually, I know which this one is. All right, so before we get into security, I would like to hear, because this is an opinion question, there's no wrong answers, but from your perspective, which technology application will have the biggest positive impact on outcomes, not the experience per se, but on outcomes? Augmented virtual reality, telehealth, remote health monitoring like smart devices, or AI-driven diagnostics. Which one do you think will have the biggest positive impact on outcomes? Interesting. Okay, so remote health monitoring and smart devices you think will have the biggest positive impact, and then telehealth will have the second one. And nobody said AR or VR, and 29% said AI-driven diagnostics. So let's peel back that from it. From my perspective, just doing what I do and being exposed to this stuff, the idea that remote monitoring is going to have the biggest impact is fascinating, and it's probably because of the adoption of things like this and the wearables that everybody does for fashion. But I do think that in your position, in your role in the future in delivering healthcare, you're going to have to overtly address concerns about privacy and security, and that's going to be so important for you to be able to assure your patients that. And it's, in your medical context, you're not thinking of yourself as a security person or a security representative, but part of the conversation with your, I always say customers because I talk to so many private companies, but part of the conversations with your patients, I think in the future is going to have to be about not just their concerns about their health or accessibility to healthcare, but also their concerns about security. And you're going to have to be smarter to be able to speak confidently about the security and the privacy of these new tools that everyone's going to be using. So that's interesting. All right, we're going to talk a little bit about healthcare cybersecurity now. And this all comes together at the end, I promise. This isn't just a bunch of slides put together at random. But we have another poll real quick. And the second poll has to do with your, what you think is the biggest reason for cybersecurity crime in healthcare. So can we pull up that second poll and then we'll continue. Internal actors, people who work inside of healthcare organizations, are responsible for what percentage of data breaches in healthcare? Are they responsible for 4%, 39%, 77%, or 81%? So while you're doing that, I'm going to tell you a little bit about what we do here at Verizon when it comes to cybersecurity. We have a very big practice providing, as I said, managed professional services to companies and healthcare organizations and government as well. We create a report called the Data Breach Investigations Report, the DBIR. For 14 years, we have published this report. It is not a report that pushes Verizon products. It's not marketing fluff, and it's certainly not best practice. What we do is we collect information about actual attacks that happened in the previous year all over the world, and actual data breaches that happened in the previous year all over the world. And we get that data from many partners. We get them from government agencies. We get them from international government agencies. We get them from private companies, law enforcement. We get them from FBI and some other three-letter agencies, and from 88 countries. And every year we collect tens of thousands of pieces of information about these incidents, which require resources and broad threats, as well as about several thousand actual data breaches. We actually created you guys are all data people, so you should know we created a language for the normalization and the submission and management of that data from 83 countries. We created a framework called the VERIS framework. It's the vocabulary for event recording and information sharing. And what VERIS does is it asks people to submit the information about the breach in language that we call the 4 A's. It's the actor. Who was the actor? Was it an internal actor? Was it an external actor? Was it a partner? What was the action that they took? Was it a phishing scam? Was it a brute force attack? Was it a DDoS attack? What was the attribute what was the asset they went after? Was it a mobile device? Was it an IoT device? Was it a core system or database or a web application? And then, what was the attribute that they went after? Was it the availability of the system, the integrity of the system, or the confidentiality of the data in it? So just as an aside, I thought you might be interested in knowing that we sort of cracked the nut there on reporting and collecting information. And if you're interested at all, you can go to VERIS community.net to learn more if you're interested in that kind of a thing. But for this report, this year just came out 3-4 weeks ago. We looked at almost 80,000 security incidents and 5,200 security breaches. And what we do in the report is we break it down by industry and by attack patterns. So before I reveal, what's been going on in healthcare, can we take a look at that survey results? Okay, so we think that half of you think that internal actors are responsible for 81% of healthcare breaches. Cynical crew, very cynical group of people you have here. No, I'm kidding. It's actually 39%. So I'm looking on the wrong column here. So 39% of data breaches in healthcare that we looked at last year were caused by internal actors. Now, you should know that that number is actually way down over the last few years. 3 years ago, it was more than 50%. And if we can go to the next slide, I'll do that. So it's the good news is that it's trending in the right way. But internal actors cause data breaches for a number of different reasons. But this is directly from the data breach investigation report. Again, it's not fluff, it's real data. And what it shows here is that the top attack patterns or patterns that led to a security incident or a breach were miscellaneous errors. I mean, everything from a misdirected email or paper going to the wrong place, which to me is amazing, to basic web applications being attacked. You see though, like, look at those numbers there, like misdelivery and publishing errors, amazing. So does that mean that everybody in healthcare has fat fingers and they send it to the wrong email or not? No, what it really means is that security in healthcare doesn't always have to be about the shiny servers and the firewalls and the antivirus stuff. It's about process redesign too. So think about the business processes that you have in place in your healthcare organization and think about where they lend themselves to mistakes, right? Are you using email to attach things that shouldn't be sent in the clear? Are you sending even vaguely innocuous information but still has identifiable information in there to the wrong people by accident? Many systems try to auto-populate and guess who you're emailing it to. You might try to send it to Bob Jones and it sends it to Bob Johnson instead. That routine, that happens a lot. We see, again, that drop in that internal number, meaning that fewer than half now is internal actors. Again, I think that's good news, and that may be recognition over the last few years that processes that are manually intensive, that lend themselves to mistakes, are being reduced, or that the electronic workflow that we're embracing more and more is mitigating or minimizing the need for those older processes that could lead to data leakage. But it's important for you to know, no matter what role you're in your organization, that internal actors play a big role in this. And you could ask yourself, why? Is it the systems? Do they do workarounds because the tools that we give them are too difficult to use? So they do these workarounds to maybe send stuff that's going to work at home over the weekend they send it to their Gmail account, and they shouldn't have been doing that. But knowing also that the external threat actors, you can see in the middle here, this is how we organize the information in the report. External actors are 61%. So you know that 61% of your security efforts need to be based on external threats. It's good to know the motivation. Financial motivation is the big one in healthcare. Monetizable, fraud-related use cases, stolen PHI is a big one. But fun is 5%, and we look at fun as that misuse of privileges. The cliche of I'm going to look up and see if my ex-wife's mom is still in rehab or something like that. I made that up. I'm still married. Mom is fine. But the idea that that privilege misuse leading to HIPAA violations, that's a serious thing. And then what this report does, though, is the DBIR. It doesn't just describe the problems. What's really great about this report is it maps these challenges that are different in each industry to security controls that organizations should emphasize. So what I mean by that is you see at the bottom here, it says top implementation group 1 protective controls. What I'm telling you is that when you read this report, bad guys go after hotels and bad guys go after retail. Oh, there's my dog. Bad guys go after manufacturers in very different ways. And bad guys go after healthcare organizations in very different ways too. And that's why the report breaks it out by industry, and it tells you the patterns that they use to do these attacks. Now, the fact that we then map it to the controls that you need means that we're not just describing the problem. The report describes a roadmap for fixing and addressing those problems. So I want to highly encourage you to grab a copy of the Verizon Data Breach Investigation Report. It's free. It's downloadable. It's PDF. You can share it with your peers and colleagues. It's at verizon.com/DBIR. Now, I'm going to move on a little bit because, as I said, we are dedicated to learning more and more about security in the healthcare industry by partnering with other organizations too. We worked with HIMSS. You guys are all familiar with the HIMSS organization. back in 2019. Seems like everything happened in 2019 and nothing happened in 2020, but that's not true. But in late 2019, we did a survey of, look at my notes here, about 125 IT and security leaders in healthcare organizations in the US, and in hospitals and acute care facilities. And what we did was we did a survey to ask them sort of their viewpoints on security and innovation and what gets in the way of things like that. So some of the numbers from this survey we thought was interesting. How important is IT security and cybersecurity to your organization? This is a perception thing. Well, 74% has said that's critical. That's a good thing. There's a recognition that cybersecurity is very important to the well-being of an organization. 23% said it's high, but it's not a critical. But that's still pretty good. So we see that there's a recognition in the survey that security is important. And just so you know, these are the biggest concerns that these folks had: protecting personal health information and patient data. No surprise there. 72% said that. Securing connected devices. That's a pretty big number because we're seeing that explosion in connected devices being used more and more often. And there's concern about whether or not they are secure. And if the IT leaders are concerned that about securing connected devices, you can bet that the patients are going to be concerned about that as well. IT leaders are concerned about fraud and being able to identify and prevent fraud, which is more on the back end. But I'm surprised by, and of course the ransomware. We've all heard about ransomware in the last few weeks. It's unbelievable if you're not paying attention. The world's, what was it, the US's biggest meat company, the producing company, shut down by ransomware. The pipeline a few weeks ago, ransomware. Here in Massachusetts, where I live, the system that gets you an inspection sticker for your car was offline for 6 weeks because of ransomware. This is a serious thing that we all need to be concerned about and plan for. But look at the number on the end. This is what I'm most interested in. IT leaders and other leaders say that their biggest concern, well, their smallest concern, is end user education and awareness. Only 39% rate that as the biggest thing. And that's a common theme, I think, in the research that we've done. And even when I talk to customers, is that they talk about a patient-centric approach and they mean it, and they understand that it is all about the patient. But I don't think there's enough clarity right now in healthcare organizations, again, from my limited perspective, on who's responsible for the end user education, right? On how to use all the new devices and all the new technologies that are being made available to them to make sure that they're staying connected, even if they can't come to the hospital itself. So that disturbs me a little bit that number is that low. And we're going to look at some more data that builds on maybe why we should all be a little bit disturbed by that low priority for user education and awareness. But we promised we're going to talk about the intersection of security, healthcare, and innovation. And here's really where that happens right here. So in that survey, we asked the question, how often does security impede innovation and digital transformation? Okay, so as I said at the outset when we had our customer advisory board, big plans, robotic surgery, we're going to be able to do all this stuff with 5G, and it's true, it's going to happen, but does security get in the way? And 17% of the respondents said that security concerns frequently stall innovation initiatives, that the security processes get in the way. They come in and they say, no, you can't do that. Or they come in too late and you spend a whole year planning something. 57% that said security concerns occasionally stall initiatives, right? When you combine that together, that's like 3 out of 4 of the respondents said that security is seen as an impediment to innovation in healthcare, as opposed to an enabler. And that's really the big trick for all of us, is to change our attitudes, but also contribute to the physical changing of how security works, to not be an impediment, but to actually be an enabler. So we're going to talk a little bit about how you can be an enabler of innovation and security working together, as opposed to working at each other. Now, we did another survey with HIMSS. This one was in November of 2020, and we talked about telehealth. And one of the questions that we asked was about decision making, and this is really sort of the crux of what I wanted to talk about today. Is that to smooth out the potential friction between innovation, technology, security, and healthcare, you need to collaborate, and you need to have a big tent and a big table. So whether or not these numbers are good or bad to you, these are just numbers that are interesting to think about. In large organizations, the average number of decision makers, when it comes to at least talking about IT security, is 11. You got to wonder, where are those people? What departments do they represent? What functions do they represent? And is there any voice of the customer or voice of the patient in that decision-making process? Is there somebody in that group of 11 who has the ear of patients, who is speaking on their behalf and advocating for them about how the organization is going to implement security, which will have a material impact on the patient experience and eventually the patient's outcomes? Mid-sized organizations, no surprise, fewer number, and smaller organizations have fewer decision makers. But in addition to decision makers, there are influencers and there are stakeholders, and that's an important thing to remember. So I thought this is interesting that, on average, 8 decision makers are involved in making IT security decisions. Is that reflective of clinical representatives? Is that representative of patients, or is it just a bunch of IT people talking to each other? We also asked in the SIMS survey, what drives good outcomes in telehealth visits? And this is good to me. So look at this one here, 85% technology ease of use, right? Patients and or physicians, that telehealth needs to be easy to use. And that patients have access to technology for telehealth visit, and that patients can feel they're participating and that they're engaged in telehealth. So that's the big 3. What drives good outcomes in telehealth visits? Ease of use, access to the technology, et cetera. But the next question we asked them was, hey, is telehealth easy to use? And all these clinicians said, well, not really. Almost a third of them said that current telehealth technology is too difficult for patients to use. Now, quite candidly, I don't know where they based all that on, except probably just their perception. But it speaks to the need to sort of reconcile where we're at right now, take a step back and say, okay, we know the future is here. We know that things have changed. We know that telehealth and telemedicine is going to be a bigger part of the everyday experience. We recognize it's important. We recognize that our patients want to use it, but if it's too hard to use, how are we making it better for them? How are we making it easier for them? Now, I want to digress for a minute. My wife, of almost 30 years, she's been in healthcare oncology for a long time, and a couple of years back, she was working on her master's degree, and she was doing her research on EHR and the reasons why organizations fail to achieve meaningful use. So I got sucked into that and helped her do some research around that, and was copy editing her papers and everything. And there was a study that she found about why IT projects fail. And it was an academic study from a few years ago. And the main reason IT projects fail, which includes innovative technologies, implementation of things like, all the things that we talked about here today, as well as security projects, they tend to fail not because the technology is not good, and not because it was poorly implemented, but because of the lack of stakeholder engagement. The majority of IT failure could be directly mapped back to not bringing in the right stakeholders at the right time during the evaluation, the implementation, the development of use cases for this technology in any setting, really. And it's important for us, or for you, in whatever role that you're going to be in the future, to know that you are a influencer and a stakeholder, and that you've got an obligation to open that up to other stakeholders, including out to the patient community, to make sure that these implementations don't fail, because all these wonderful ideas that we have kicking around aren't going to stick if they're too hard to use. I see 2 questions up here, and I'm going to address them if that's okay, because they sort of, before I go on, what have been the trends in terms of absolute numbers of attacks and breaches? Okay, so the question again, what have been the trends in terms of the absolute number of attacks and breaches? I'm going to assume that means in healthcare, but in general too. We every year, the body of information that we get from our partners grows. So while it is not the absolute 100% capturing of everything bad that's happened in the previous year, our consistent set of data grows every year because there have been more and more attacks. We've seen over the last couple of years a consistency in the way that attackers have come after organizations. Distributed denial of service attacks, DDoS attacks, which knock systems offline because they send like a tidal wave of toxic traffic to the websites. That has consistently been one of the top 3 patterns of attack on all organizations in the world. We see that a huge increase in phishing, PHI, phishing with PHISHING, those emails that look real, but they're fake and they bring in malware. Ransomware. We've seen lots of examples, particularly in healthcare. You guys probably all heard about the WannaCry attack a few years ago, and Great Britain actually led to the death of somebody who wasn't able to access their healthcare because of the ransomware and the attack. So we're seeing not only just ransomware, but we're seeing ransomware that holds your data hostage, but they also steal the data, and then they want another ransom to not release the data. So it's getting worse, but at the same time, organizations are getting better. We're seeing that the time it takes to detect compromises has accelerated greatly in the last 3 years. It used to take, on average, months, sometimes weeks, sometimes months, even a year, to realize that your systems have been hacked. And that number was always in the 50% or so range, but it's gone way down in the last year. Companies are getting smarter, organizations are getting faster when it comes to being able to detect these things. Another question we have is, have malicious external attacks increased in absolute number, or is internal non-malicious breaches decreasing? I think I spoke to that a little bit a few minutes ago. I think that the external attacks have definitely gone up, but I do believe that the internal, they're not attacks. The internal breaches are caused, again, by mistake, sometimes by people acting in nefarious ways. Maybe they've been compromised and they're stealing data to sell. But mostly, I believe it's process, and I believe the process has gotten more digitized, which can lend itself to data leakage. But I think it's gone down because with less reliance on paper. So interesting. We've got all these different attitudes and perspectives on things. So what do we do? How do we deal with all this stuff? Right, I'll come back here. So for me, again, the preaching that I try to do is the idea that collaboration is so important in the healthcare context, that you've got to have the right people at the right table before you start spending a lot of time and money on all of these cool new things that you can do. I do want to tell you that Verizon has been really working closely with the healthcare community. As an example, we have a great partnership with Emory University. In February 2020, we announced this partnership where we brought 5G into their innovation lab, and we've been testing out use cases and applications for all the things that we talked about here today, AR and VR, to develop safer surgical procedures and distance medicine. It's been a great experience since we cut that red ribbon over there. You see in the picture for the last year. The idea of partnering with healthcare organizations is so important, because we can do this in isolation and try to be smarter than the average bear, or we can really, again, collaborate with people who are leading in the industry like you to develop the products and services that they need. Our 5G labs across the world, we've got 5 in the US and one in England as well. A lot of what's driving the 5G labs that we do research in is healthcare use cases like robotic surgery and such. So I went a little bit faster than I thought I was going to go, but I just wanted to close by saying that, again, no matter what your role is in healthcare right now or in the future, you have to remember that you are an influencer, that you are a constituent, that you are a stakeholder, and that you have an opportunity and you have a responsibility to have your voice heard. The technology is not someone else's job. It's all of our jobs to get the most out of it, to advocate for the patient and the patient experience, to advocate for better training internally, so the cool new tools that you use as a clinician don't get in your way, that they don't impact the patient experience because you're spending the entire time looking at your screen and not talking to them. You have to advocate for systems that don't get in the way like that. And I think it's important to not just accept, the things that are coming, but to be involved. And that means that our jobs, whatever your jobs are going to be, means there's another dimension to your job, which is sort of technology, maybe not expert, but that you are a technology, again, influencer and innovator. So I want you to, and particularly with your association with this institute, you are perceived as a leader. So you already have a voice just by the fact that you're participating there. So I hope I didn't go too fast, but time is money. So do we have any other questions? With regard to EMR innovation, what are companies doing to ensure that they meet the needs of patients and clinicians rather than just focus on billing and coding? I can tell you what we're doing. Again, we launched this thing called Blue Jeans Telehealth. We acquired a platform for video called Blue Jeans at Verizon, and we've allowed it to integrate with a number of electronic medical record systems. So the integration through API is helpful there. You've got all that billing stuff there, but part of that is for the platform for us is knowing that the experience has to be good for the user. So it's Dolby sound, and for wherever that matters, it's a good, clear connection. Sometimes when you've got a bad connection and you're saying, "Can you speak up?" and I can't really hear you, that changes the dynamic of the patient and the clinician's interactions. So it's a high quality experience. But I think that that consistency of use and that idea of an omni-channel approach, because not everybody wants to sit down or has a laptop to sit down and do a Zoom call, right? There are some people who are all about the applications and the portals that they can use. There are some people who don't mind chatbots and actually would rather talk to a chatbot than to an actual human. So it's got to be, I think, patient-centric, patient first, and you don't let the technology and the shiny marketing material that people are coming to you with get out ahead of the need to give that good experience, that digital front door that we talked about. I have another question. How should healthcare, IT, and I'll stop reading in that voice. How should healthcare, IT, and clinical professionals engage and educate patients? Educating patients about the intrinsic risks of health IT systems appears to be important in mitigating the risks of attacks and data breaches. Also, patients may often have unrealistic expectations about the degree of achievable system security risk and the risk benefits of using health IT technologies. There's a lot to unpack there, so we'll start at the beginning. I think it is, to some degree, a burden and some degree responsibility, but ultimately the trust that patients will have in their providers who can speak to the experience of using telehealth and are knowledgeable and give them the confidence that they care about that experience means extra work for you guys in the clinical setting to be able to be a subject matter expert to some degree and to give them that confidence that the system is worth spending time on. You may not be a cybersecurity expert, but you should be able to look at the report that we just shared with you and know that that you can speak a little bit to some of the risks. I think that it's not an individual question, though. I think what it is that organizations in their governance of IT technology, when they get together to talk about implementing these systems and new technologies and new applications, I think they also need to have, as part of that governance plan and overall program, is that end user community education component, right? They've got to be able to say that we are going to put as much time and energy into educating our patients and giving them confidence. You spend so much time telling them that the facility is clean and that we wipe the doors every 5 minutes and come in with hand sanitizers and you do the screening for the health, right? It's the same thing for the patient experience on the other end of the computer. And you've got to be thinking, say holistically, but at an organization level about who's going to do it and how you're going to do it. I hope that answers that question. That's just my opinion.
I did, Dave, one of the things that happens right now is we have a, CMS recently released a rule that basically says patients should have access to their data from their payers on July 1st of this year. And that means that if you wanted all of your claims and clinical information that your insurance payer has, they're obligated to provide it to you via an API, which allows an app to consume it. What are your thoughts on sort of that free-for-all, fire API, like, hey, this is all going to be available. Any third-party app can go and access it.
It's troubling, I think. Particularly around that, like I said, any third-party application, any API. I think that who's responsible to vet which systems are able to consume that data? Is that the patient, or is that the insurer, or is that the healthcare? It's more than a rhetorical question. I don't know if you have an answer, but
insurer is responsible for vetting the third-party app and educating their members. However, they cannot, by law, forbid the third-party app consuming that data. All they can do is educate their members about what risks that they are taking. The only reason that they could cut somebody off is if that person poses a provable security risk to the payer themselves.
We did another report recently called the Mobile Security Index, and we looked at the dangers of application security or the lack thereof. And one of the things that we recommend organizations do when it comes to application and risk mitigation is to be able to vet those ones. So I think it's a tough situation, but what you're saying is what we're advising, which is if you're going to recommend or allow applications to be used by your user base, check and see if they have excessive permissions. Why does that app need to get into your camera or your microphone or your clipboard, right? And then the third-party ones that you can't control, to your point, education now becomes just as much a responsibility. Like cyber health and cyber hygiene is the same kind of a conversation that you have to have with somebody about their physical health and their physical hygiene, right? And that changes the delivery of care, and it changes, I'm changing that's how you're learning to become a doctor or something when you're in med school, right? I'm hoping that they're teaching you guys that and emphasizing the need to do that. That self-care, right, also goes to cyber care, right? So it's a balance.
So I think it's really interesting because so far, most of your talk and most of this audience is on the provider side, future doctors of America, as well as, the technology team that is going to enable clinical care. My background is mostly on the payer side. And so there's really, on the payer side, this feeling that that they are responsible for ensuring that their members are educated about these risks. And so there are actually big industry groups trying to create various levels of standards and code of conducts that, they want people to attest to. And so I guess my question for you is, as you see these types of checks and balances come in play, where do you see the role for innovation? Because sometimes, I think about these teams and they're young, scrappy, and hungry, and they may not have a CISO, that's Chief Information Security Officer, that they can rely on, which is part of the reason why we wanted to bring this talk to them.
Yeah, I often say that, innovation can easily outpace security oversight. And when you look at some of that data that says there's a perception that security gets in the way, it's easy to say, well, look at the security later. We've got to get to market with something quick. We've got to get something into production by Friday, we promise, right? But that's a short-term thinking. And if you can put into place either the processes to ensure that security is part of the conversation, part of the evaluation, part of the innovation. But security folks tend to be pretty smart, and if they understand the business, they can contribute a lot to the evaluation of the technology and the applications, and also the use cases, right? And they can think a little bit differently about how. So I gave a talk recently on 5G, and I thought I was clever because the way I framed it was, I said, when something cool like 5G comes out, the consumer says, what can it do for me? And then when 5G or something cool comes out like that, the business leader, the executive says, what can it do for us, right? But the security person says, what can it do to us? So they come in from a different perspective saying, what can it do to us? So like you invest in whatever benefits you give your people or whatever infrastructure you have, security, you can't neglect it. You got to build it into the innovation evaluation.
I think most of your points sort of, once again, highlight the reason why we launched this institute, was that so much of innovation in healthcare with, brand new computing methodologies and all of this requires a collaboration that is between, people giving care, people developing technologies, people looking at data, and, security. And, we bring ethics, and we also bring, health equality into that, equity into that conversation as well. So I don't see any more questions, and I don't see any raised hands. So I did want to thank you very much, David, for giving this talk. And, thanks for kicking off our series.
Well, I wish you luck with it. I'm going to try to tune into some of the future ones, so I'll be watching your Twitter handle.
Sounds good.
Thanks for having me. Appreciate it very much.